Hello, everyone. My name's Jeanette, and I've been a Fastaff travel nurse for a little over 4 years. My specialty is med-surg, tele, step-down, and PCU, and I've done about 10 assignments with them. So, why do I like working with Fastaff? One of the biggest reasons is that their rates are on the website. They're very transparent, so what you see is what you get, and it's usually a high rate. And on top of that, they cover your housing and they also cover your travel. You can take the stipend if you want, if you like looking for your housing and your travel. But for me, I like everything being set up. So all I have to do is just work. And then when the assignment is done, they can just fly me home. Another thing too is that I really enjoy working with the staff. My recruiter, Chase Shields, is awesome, but I've also got a chance to actually go up to the headquarters myself and meet some of the other staff members, and they're all very helpful, and they're just a phone call away, and a lot of them now are on Facebook too, so it really helps for them being very flexible in being able to reach out to us when we need help. So that's really cool of them. So what I do love about nursing is helping our clients, which is usually our patients, reach their goals, which is to go home. So what I do is I include the patient and their families into the plan of care so we can get them back to optimal health on some of the things that they enjoy. An example I had is a patient. He just loved golf. So him being in the hospital was just a huge hindrance to him doing what he loves to do. During his physical therapy, I had asked the physical therapist, hey, is there any way you can include golfing in his rehab? So the physical therapist, who is an avid golfer, said, oh, that's not a problem. So part of the therapy, when I was walking down the hall, I noticed that they were practicing a swinging motion as if he had a golf club in his hand and was swinging. And I noticed too, in like the little physical therapy room, they had like a little fake grass. He had a golf club, they had a tee, and then he was able to swing a little so he can start getting used to having that swinging motion. And he even scored a hole in one. So when it's time for him to be discharged, he was like, the next time I see you guys is on the golf course. It was probably one of the most awesome moments I've had, seeing him being sick and being able to go back to doing what he loves to do, which is golfing. And the family members were also happy because they were also avid golfers. Another thing that's really rewarding about being a travel nurse is being able to visit places that you never thought about even going to and enjoying. Good example of place is Plattsburgh, New York. It was like the neatest assignment. We were in the middle of nowhere. There was hardly anything to do there. But the fact that I got a chance to visit Vermont, go see how beautiful it is, see Lake Champlain, go to Montreal, Canada, go to the Underground Mall. And on top of that, the assignment was great. It was a PC unit, had 4 patients, had a free charge, had an educator, and it also had an assistant manager. It was really, really neat. If it weren't for a travel nurse, I would have never thought in a million years to go to Plattsburgh, New York, and that I would be near Canada and be near Vermont, which is another state I never thought I would go to, and be able to have the chance to go to Albany, New York, and enjoy the winter wonderland. One thing about being like a travel nurse is you become well-rounded and you see different types of patients, and it can really help in your work. I'm on the oncology floor, and none of them are ACLS certified, and they have the charge nurse who's looking at the monitors. She's not ACLS certified, but she has to sit at the desk. I was just happened to be behind her, and I noticed the patient had a change on the heart monitor. The heart was beating irregularly. In fact, there was this elevation that looked like the patient was having a heart attack. So I told the nurse, and she was like, are you serious? I said, how can you tell? And I showed her. We all went in a room, and the patient was complaining of having this really bad indigestion pain. And he was sweating, but he said, oh no, he said, that's probably something I ate. And I said, well, you know, sir, we really need to do a 12 lead EKG, which is a monitor. We want to look at the heart in 12 different places. We place it on him, and sure enough, he was having a heart attack. The charge nurse was on it. She called it cath lab team. She called the internal medicine doctor. They had him in there. They put him on a cardiac floor, and he was taken care of. And in 3 days, he was better. And it was so nice because he had to make sure he came down there to say to us that we were an awesome group of nurses, because he said if it weren't for us, he said he don't know if he would be alive or not. So he said, so next time when somebody even has some indigestion pain or any sort of symptoms of heart attack, which we instructed him about, he said, I'm a let him know, because you just never know. So I thought that was really cool, being able to share that experience. It helped that floor too, and it helped them say, at least if the nurses aren't ACLS for it, at least the charge nurses should be, since they're going to be the ones looking at the monitor. So that right there was a good moment to share an experience that I've seen in other assignments to apply on a floor that truly never gets patients that have heart issues. I've had some challenges, and probably the most challenging one that I've had was this one patient. And he was so mad. Nothing kept him happy. I mean, the room was sparkling clean, but he said that the cleaning lady missed the spot. He said the medicines weren't working. He told us the food was not good. He was like, I'm just so sick of people coming in here. Everybody keeps coming in my room. I'm so sick of this. And then I was talking about maybe we need to go over the plan of care for today. No, we're not going over anything. I'm just so sick of it. And I said, well, sir, what did we do to you to make you so mad? Because we must be doing something wrong. He said, no, y'all just can't do your jobs. I can't watch football. And then it hit me. I said, sir, are you mad because you're not going to be able to watch football? And he was like, I've been waiting for this Eagles game, and I can't even see it. I got the NFL ticket at home. And I said, okay, well, how about this? Would you let me go ahead and try to see if I can figure something out so you can watch your Eagles game? He was like, if you can watch my Eagles game, I won't cut the fool, because I know I've been cutting the fool since I've been here. So I have the NFL Sunday ticket because I'm also a football fan, and I just so happen to have my laptop. So I asked the charge nurse, and I was like, do you think we could just go ahead and I can use my laptop to see if he can just watch his Eagles game, because I have it. And she said, if anything at this point, she said it don't even matter, because we can't do nothing with the patient anyway. He been refusing treatments. He barely be taking his medicine, and he won't eat. So I was like, okay, we'll do it. So I set up the TV, and you talk about his face just lit up. He was just so happy. And thank goodness the Eagles won, because if they lost, I don't know how this would have turned out. But he was happy, and he said, you know what? You guys are a good group of nurses. You know, I probably need to go ahead and stop acting the way I am. I better start taking my medicine more and taking it seriously. I need to learn the education, and I really probably need to start learning how to take care of my diabetes, because this is probably why I was in here in the first place, because I wasn't eating what I was supposed to, and I wasn't checking my blood sugar. So after that experience, I was like, that was really cool. It showed me that sometimes you got to let the patients vent, because a lot of the time the issue isn't what we're doing. It's just, there's just other issues that had nothing to do with the nursing care. It was just the fact that he was missing football. So when we get to the root cause of things, sometimes just let them vent, figure out the problem, and most of the time you can get to a solution. So that was actually really cool, because he was one difficult cookie. The most miraculous thing I have seen during my time as a Fastaff traveler, I was in this one hospital in New Jersey, and the lady came in for a hernia repair. Not sure what happened with the surgery, but from what I've heard, they said that they nicked her bowels, and she ended up getting septic. So she was very malnourished. She kept getting infections. The family members were like debating whether should we even have surgery. And then the doctor was like, if we do that, well, maybe we should consider palliative care. So the patient was like, you know what, let's go ahead and go for the surgery, because if I don't do it, I may not make it. And if I do it, I may not make it. So I'd rather just go out fighting. Well, we did the surgery. First of all, boy, she just kept getting infection after infection. She was in the intensive care unit. Her blood pressure, we just couldn't maintain it. It kept getting too low. And they were like, they were thinking that, man, she's just not going to make it. We put up every kind of medicine to keep her blood pressure going. And I was like, wow, this is not this was not really working out very well. All of a sudden, the patient's blood pressure was good. She started breathing on her own. She started she started moving her extremities, and before you know it, she moved from the intensive care unit. She moved, and she was there for about a few months, about 2 months. Then she moved down to the progressive care. Then she moved to med surg. She went to rehab, and now she out here selling makeup. She's doing really good for herself, and I've never seen anyone who's been so malnourished, been through so as much as she has, and many infections to come out as good as she did. So miracles do happen sometimes. Like I said, modern medicine can really help, and also prayers can help from the families, because they did a lot of that, and I'm just so happy it worked out for all of them. Thanks to Fastaff, I've been able to visit a lot of the United States. I've been able to be financially free because of the fact that we work 48 hours, and most places we work at, we can have overtime. And going to my assignments, I've been able to invite my friends and family. So it's almost like we had like 2 vacations that year. Since Fastaff has been able to provide my travel arrangements, housing arrangements, it was just almost as if that we can have 2 vacations, because once I was done, I had enough time to have another vacation, had enough money saved for another vacation. A few years ago, I was able to buy my house. It's just been wonderful working with them. They just make travel nursing so easy. They take care of everything. They cover a lot of the expenses, and most importantly, finding housing, which is my least favorite thing. So I recommend everyone join Fastaff and see how good the company is, because they have a lot to offer, and more importantly, they make it fun because they take the stress out of it by taking care of everything.